What class is this for?
For AP Lit.
Okay.
Yeah, that's our last senior project, big thing of the year.
Okay.
All right. So, hi, my name is Zachary Bowie. I'm recording this interview. This is for AP Literature and Composition. Christopher Schultz. This interview will probably take 1.5 hours. So, can you please introduce yourself?
My name's Tony Chung.
What is your job and your responsibilities, your title?
I'm a nurse practitioner. My specialty is in orthopedics. I work at the Keck Medical Center of USC. My job there is to help the throughput of post-operative hip and knee patients, basically from recovery room to planned discharge, which is typically the next day after surgery. To help them kind of traverse the healthcare system and get out on day one. Yeah.
So during a normal workday, what do you have to do and how long are the hours?
Typical work day, so it varies. Certain days are more work intensive, specifically the days that after the operations. So there are certainly days where there's a lot of computer work to do, where I'm reviewing patient histories, and then now that most hospital systems have gone to an electronic record-keeping system, one of my responsibilities is to load all of the order sets. Formerly, we would handwrite these, and then we have pre-printed forms, and now we've moved on to electronic ordering. And so one of my jobs is to enter the appropriate order sets for the patients, review pertinent patient history. That kind of encompasses the computer part, the actual hands-on interactions with the patients. Typically would be on the next day after surgery, where I would remove surgical drains, take down surgical dressings, order discharge medications, order home health. A lot of our patients need, almost all of them, need home physical therapy, home occupational therapy. Did I talk about ordering medicines?
Yeah.
So we order their discharge medicines, remove drains, change dressings, provide education for the patients.
So would you say it's a very labor-intensive, hands-on experience, or it varies day to day?
Even at its busiest, it's not terribly labor-intensive. So no, I wouldn't characterize it as labor-intensive. It's kind of a mixture of using your head, using your brain, and then certainly some hands-on component, but it's not like we're digging a ditch or anything.
Okay. So also it's very important to have a good knowledge and usage of technology with your job?
Yeah, to a certain extent. I mean, to the extent that we need to be able to access our computerized system, which came online about 8 to 10 years ago, when we went from kind of manual written orders to computer entry.
Okay. Would you say your job is very structured from the day? You would know what you have to do every single day, and it's very organized, patient by patient?
Yeah, at this point, I've been in my current position for over 20 years now, and you kind of develop a certain rhythm to your day, and so it is structured. It's my own structure to so that I can get the patients out timely.
Okay. So what are the hours of your job? Does it vary every day, or how does it work?
Yeah, typically I'm in the hospital for 6 to 8 hours every day. Some days are longer, some days are shorter, but that'd be 6 to 8 hours would be average.
So with this job, is travel involved, and do you also need to work weekends?
No travel and no weekends. One of the benefits of working at an academic institution is that when I leave, there are physicians, other personnel to come in behind me. So I don't have any of those responsibilities.
What would you say is the biggest difference between a regular nurse and a nurse practitioner?
Well, It's a pretty big difference actually. So nurse practitioner is going to fill a nowadays, and the role has grown over the last 35 to 40 years. Um, the hospital will describe us as mid-level providers, and so if we were to draw circles indicating job responsibilities, traditionally you had nursing in one circle and physicians in another circle, totally separate. Nurse practitioners, our circle kind of overlaps a little bit of regular nursing and into the physician's circle, in that I can things that traditionally were relegated to physicians, like ordering medicines, making diagnoses, ordering lab tests, evaluations, consults, those sorts of things. I do fairly routinely.
Interesting. So, what education do you need your job? Like, how many years of schooling do you go? Your undergrad, your master's, anything after that?
Yeah, so nursing is a unique profession in that you can start nursing with a 2-year degree, although by and large that's kind of the dinosaur degree. Most facilities now they require a bachelor's degree in nursing, and certainly if you want to have any upward mobility, you have to have your bachelor's. For nurse practitioners, when I went to school, it was about 2.5 additional years, and I graduated with a master's in science degree. Now the profession is such that the entry-level nurse practitioner degree is a doctorate. So over the last 20 years, that's changed a lot.
All right. So what job experience is necessary, at least preferable for your job before entering, or is it like an entry-level position where you can just come in?
Sure. So there is some controversy in that there are some nursing programs that will allow students to go to obtain their bachelor's in nursing and go straight through and obtain their nurse practitioner's degree. I've always felt, my personal opinion is that you really can't hold yourself out to be an expert nurse until you've done some nursing, until you've worked some. So I've always felt that there should be some amount of time spent in the nursing profession before going back for an advanced degree.
Okay. So do you go to like school to become a nurse practitioner, or is it different becoming a nurse? And like, is it two different schoolings?
Yeah, two different. Yeah. So nurse practitioner school, you can't apply to nurse practitioner school until you have a bachelor's degree in nursing. So that has to come first. The bachelor's degree in nursing is just like any baccalaureate degree, 4 years of formal schooling. And again, I've always recommended, whenever I've been asked, I do recommend working for at least a few years before going back to get to go back to school.
What do you find most appealing about your job? Like, what do you like most? The hours, the pay, like the people? What do you find most appealing?
That's a great question. Oftentimes when I'm asked, I say that I've won the work lottery. We're not lucky enough to be financially independent, and so I'm part of the most people have to work for a living. But I really do enjoy what I do. Probably the best part of what I do is being able to make independent decisions, and being able, within the framework of helping a patient from right after surgery to being able to go home the next day. A lot of things have to happen in order for them to be able to go home the next day. And it is very satisfying to help transition someone from after surgery, when they're in pain or whatever, they're certainly not ready to go home, and then really within 24 hours you get them ready to go home.
So what do you find least appealing about your job, and what do you think would be helpful to change?
My least favorite part of my job is all the computer work. It's it's very dry. There's no human interaction, but it's something that needs to be done because we're ordering medications for patients, and if you haven't read the patient's history and know what other conditions they have, certain medicines you order, certain therapies you order could harm them. So that's something that has to be done. But it's like research. It's very dry. So that's my least favorite part.
Yeah. So is the computer work very meticulous and like monotonous in a sense?
Yeah, that's a good way to put it. You need you're reading patients' histories, medical histories. Certain medicines that we use after surgery will impact body systems. And so if they've got a pre-existing condition, and you order a medicine that will make it worse, obviously that's not something you want to do. And so you do need it's part of the job where you really can't make a mistake. Yeah.
So what is the difference between working in a academic institute like USC Keeks or like a hospital, normal hospital?
Sure. So people who access healthcare, they have many choices. So there are institutions like Keck, an academic center where you have typically the most modern approaches to surgical approaches and the practice of medicine. So that's kind of cutting edge. It's on the leading edge of healthcare. Community hospitals, that are not teaching facilities, the physicians that they hire, there is no system there is no formalized system in community hospitals to kind of bring forth the newest therapies. It's a lot of times it's what the physician learned whenever they graduated, and if they'd been there for 10-15 years, they're typically doing things from 10-15 years ago. Their techniques. Certainly that I'm generalizing, I'm sure there's studious physicians out there or surgeons who remain current, but there is a wide margin, I would say, between a community hospital and an academic center where you're really getting the most current treatments.
So you're given like more resources and like just better
more
technology?
Resources and really access to what is working today, best practice.
Okay. So what inspired you to pursue a career in nursing, and what motivated you to become a nurse practitioner specifically?
Yeah. I stumbled into nursing kind of accidentally. Out of high school, I thought I wanted to be, I went to Cal State Northridge as a business major. Did pretty poorly, even though I was trying really hard at that point. And it took 2 years to figure that out. When I did figure that out, I felt pressure as all of my high school classmates were 2 years into their 4-year degrees, and so I had made a decision to go to vocational school to be a surgical technologist. Surgical technologists are people who, if you're having surgery, they're the people that set up the surgical field. They're the ones that are handing off instruments to the surgeons. It was during that training that I was working next to or side by side with scrub nurses. So same job, but they got paid a lot more. And so it was during my training as a surgical technologist that I decided that my calling is nursing, really a financial calling, because I was young. I was in my 20s, and so that led me into nursing. And once I was a full-fledged nurse, I wanted to pursue an advanced degree. I knew I didn't want to stay as a bedside nurse.
Okay. So can you discuss the other areas of specializations like within nurse practitioners?
Sure. Just like you have every medical specialty, say cardiologist, nephrologist, endocrinologist, cancer doctors, pulmonologists, for every medical specialty and every there's a nurse practitioner to kind of fill that role in that specialty. So my current role, I stumbled into it because it was what was offered to me when I was a new graduate nurse. I was offered a job in orthopedics, and I've remained in orthopedics for my entire career.
Okay. So, based on most of your interactions, is it mainly with patients or other healthcare professionals, and how do you collaborate with like doctors or specialists or even your patients?
Sure. Daily collaboration with physicians, with nurses, case managers, physical therapists, occupational therapists, social worker, pharmacy. Really, those are kind of all the components, all the cogs on the wheel that we all need to push in the same direction, because all those specialties play a role in helping to transition a patient post-operatively to home. So daily interaction with all of those various ancillary specialties.
What strategy do you use to stay current with advancements and changes in healthcare practices and treatments?
So as a nurse practitioner, and as well as nurses, we have when we renew our licensure, there are minimum hours of education that we have to fulfill. They call them continuing education units, and so it's through that mechanism that we, as a profession, that's how we stay current.
Yeah. Do you have to like continuously renew your license every couple of years? Or?
Yeah. So nursing degree or nursing licenses are renewed every 2 years, which is the same as every 2 years for the nurse practitioner, and then because I'm able to write prescriptions, I have to renew a furnishing license also.
All right. So, can you share a particularly challenging case or situation you've encountered in your practice, and how did you work around it and navigate that situation?
Sure. When you work in a hospital, oftentimes there are sick people, and so probably the most challenging scenarios that I've encountered have to deal with patients who have medical emergencies. It's what, if you're watching TV, that's the code blue, and so and that is a scenario where someone has either stopped breathing or the heart has stopped. And so fortunately, because I'm in orthopedics, most of our patients are fairly healthy, although there have been instances where there have been true medical emergencies, and those are always the most difficult to kind of work through.
Okay. So lastly, could you share some insights into the future of nursing and the role of nurse practitioners like evolving in the future?
Yeah. So even in so nursing and nurse practitioners, just like there will always be a need for physicians, police officers, firemen, computer experts, there will always be a need for nursing. As people will be sick, and they need to access healthcare. So it is a profession that really has no end. As far as nurse practitioners, it's still still growing from when it first started, and I don't even know, I should know, I don't really know, but it's probably been about 45 to 50 years since the first nurse practitioner started working, and even in the last 20 years of my job, if you take just my hospital, I was one of 5 nurse practitioners about 20 years ago, and we're well over 300 today. So it's grown a lot, and I see it continuing to grow and playing a vital role in the delivery of healthcare.
Okay, that's it. Thank you.